Welcome today. My name is Heather Johnson. I'm assistant professor at the School of Pharmacy and a clinical specialist in solid organ transplant at UPMC Presbyterian. You're with us here today because you're interviewing for one of our pharmacy residency positions for the upcoming year. Right now, I want to talk a little bit about the Department of Pharmacy and Therapeutics and give an overview of the interface with UPMC and our residency program. We have been conducting residencies at UPMC and Pitt for a long time. In the early 1990s, we began with oncology and pharmacy residency programs and have added multiple programs over the years. At present, Pitt partners with UPMC health hospitals across Western Pennsylvania, as well as community pharmacies, including Estes, Giant Eagle, Rite Aid, and other pharmacy providers such as CVS Health and the UPMC Health Plan. This collaboration allows our residents to interface with one another. It allows our residents across the system to have rotations within different hospitals and health providers within the system, and allows us to collaborate on residency research as well as teaching. As a resident in our program, you will have the opportunity to collaborate with many residents from across the system. We have well over 45, upwards of 50 residents in our collaborating programs, and we have a host of fellows as well. This increases your opportunities for rotations, and it also offers you opportunity to learn about the residency programs conducted at other facilities within the area. Within the Department of Pharmacy and Therapeutics, we have over 45 full-time faculty that practice in either institutional, community, or other capacities. Our faculty conduct clinical and translational research, as well as outcomes and policy research. The School of Pharmacy is right across the street from Presbyterian Hospital. As such, it makes for, when we are physically present, an easy collaboration between our residents here within the UPMC health system, as well as faculty and students at the School of Pharmacy. This is a snapshot or an overview of Pittsburgh. You can see here the downtown Pittsburgh in the bathroom and our Pitt corridor here, along with the health sciences, our dorms, and the health sciences over here. It's a lovely space, and we hope that you will come to enjoy this space if you choose to come to UPMC Presbyterian. Our clinical pharmacists operate in a very collaborative model. You will meet many of these people on site, or you will see some of these people have moved on to other venues. But our pharmacists who are hospital-based and our pharmacists who are faculty-based have a strong collaborative effort towards caring for our patients. In the Oakland corridor, you will find the other health sciences as well. The School of Dental Medicine, School of Nursing are very present in what we do. And there's opportunities also to collaborate or teach within the School of Public Health, School of Health and Rehabilitation Sciences. All of these are very centrally located within Oakland. As I said, we have a large number of residents in our system, as well as fellows who participate in both the bedside care of our patients, as well as research that increases and enhances the level of care that we can provide for our patients. As a snapshot of one of our residency classes, this year we weren't able to take one of these photos. Many of these residents have gone on to greener pastures and have begun to develop their careers. Some of them have remained with us to develop their careers. But this large group and this increasing group is an ever collaborative, ever connected group of individuals who will always hold Pitt Pharmacy and UPMC as part of their educational genealogy. We have a separate video about the residency research series in which Dr. Sandra Kane Gill explains our residency research series in more depth. What I'd like you to know is that the residency research series is something that our Presbyterian residents will participate in, as well as other residents throughout the system. It is a structured didactic research series that begins with didactic lessons and then folds into mentored research working groups. There are several clinician participants in our residency research series who are the lead mentors for our resident research working groups. That these working groups help facilitate the progress on your research on your research program. All of our residents will present their research at a UPMC Pitt Residency Research Day at the end of the year, either in virtual or live setting, depending on what would be allowed at the time. This allows us an opportunity to share your research across the health system and with other pharmacy groups in the area. It offers you an opportunity to get feedback from your peers and develop and demonstrate your presentation skills. The UPMC Presbyterian residents also present their research in smaller venues on the UPMC Presbyterian site to get immediate feedback from the clinicians and faculty who are practicing at UPMC Presbyterian. The Teaching Mastery Program is another opportunity that is hosted by Pitt Pharmacy. The Teaching Mastery Program is a longitudinal mentored teaching program in which there's opportunity for one-on-one or one-on-a-few faculty engagement. You'll be working in small groups in some activities, as well as one-on-one with various faculty mentors for the development of content. The requirements are extensive but completable. For some of the PGY2 programs, the Teaching Mastery Program is a requirement. For the PGY1 program, the Teaching Mastery Program is an elective, but an elective that is very completable by our PGY1 residents. I would say that greater than 99% of our PGY1 residents in recent history have elected to and successfully completed the Teaching Mastery Program at UPMC Presbyterian. We allow you the opportunity to engage in the active learning, instruction, and evaluation that happens at Pitt Pharmacy. We utilize problem-based learning, simulation, standardized patients, and standardized colleagues, all to teach and evaluate our students within the School of Pharmacy. There are also opportunities outside the School of Pharmacy for teaching. Some of our residents have conducted lectures in the school or in the social work program, dental program, among some of the other health sciences. At the end of the Teaching Mastery Program, you will leave us with an electronic teaching portfolio that you'll be able to use to showcase your teaching abilities, both in the classroom and outside the classroom. The Teaching Mastery Program is designed for anyone who will be doing any sort of teaching, which I tend to think is everybody, whether you're teaching other clinicians or patients. Our clinical pharmacists at UPMC Presbyterian and throughout the system, both faculty as well as unit-based pharmacists, provide patient-centered care. We are at the bedside with our physicians in selecting medications and monitoring outcomes of those therapies and assuring that the drug is safe and effective. You will learn in an environment where you are side by side a pharmacy mentor. The degree to which you are side by side or on a short or long leash depends on the amount of autonomy that you have earned with our preceptors and in our program. But you will be the face of pharmacy providing care for our patients at UPMC Presbyterian. We have clinicians and faculty in a wide range of areas. Our particular strengths, I feel, are in the area of critical care and transplantation. We have a cadre of unit-based and faculty-based pharmacists in virtually all of the intensive care units, ranging from trauma, neuro, surgical, transplant, cardiothoracic, ICU, the CCU, and a very large group of transplant pharmacists in all the organ transplant systems. There are both ambulatory and inpatient opportunities in transplant, and we offer a wide variety of experiences in medicine as well. We have a robust antimicrobial stewardship program that serves as a required rotation for all of our PGY1 residents, and there are some infectious diseases rotations that serve as electives in the PGY2, in some of the PGY2 programs that we have. Among our critical care area is a mix of faculty and unit-based specialists who all participate in daily interprofessional rounds, as well as protocol development and other initiatives related to patient safety. They have been fundamental in helping us manage various medication shortages, as well as providing education to growing and learning physician groups as well as nurses. And there's a significant amount of clinical research and outcomes research that comes out of our critical care group. On the transplant side, we have faculty in bench research and pharmacokinetics, as well as those who take care of patients at the bedside. We have a mix of faculty and unit-based pharmacists caring for patients who undergo heart, lung, kidney, liver, and pancreas transplant, and we have clinicians in the area of small bowel or multivisceral transplant as well. There is an outpatient component to our transplant pharmacy group, that sometimes is an opportunity for our residents as well. In terms of the medicine specialties, there are various opportunities to work with our clinicians in geriatrics or psychiatry, additional medicine rotations, and oncology experience, both at Magee Women's and at Shadyside. As I indicated earlier, our antimicrobial stewardship program is very robust and is actually award winning. We have a very strong group of infectious disease pharmacists who are guiding antibiotic use at UPMC Presbyterian. We have a robust pharmacokinetic service, and all of our clinicians and residents do vancomycin therapeutic drug monitoring, both TROF and AUC-based monitoring where appropriate. And our antimicrobial stewardship team is involved in drug selection and drug therapy optimization. Cardiology is one of those areas that spans the critical care to the ambulatory side. We have pharmacists who operate in our cardiothoracic ICU as well as our cardiac care unit. We have a significant genomics program to our cardiology pharmacy program. We also have pharmacists on the outpatient side managing anticoagulation, as well as patients with heart failure and pulmonary hypertension, in addition to the management of hypertension and hyperlipidemia. Patient safety is a major concern for all health systems, and UPMC is no different. We have the luxury of having Peg Verica, one of our pharmacists, as the safety officer for the health system, and Sandra Kane Gill does a significant amount of research in the area of patient safety. All of our residents have the opportunity for elective rotations in outcomes research and patient safety, and may participate in some of our multidisciplinary committees with regard to patient safety. Our clinical pharmacists are not just in the inpatient setting, they're also in the ambulatory care setting, educating patients and clinicians about medications and assuring adherence to medications. Some of our ambulatory care clinicians are in areas that touch the lives of our underserved patients and help us manage the transitions of care between hospital and home. If you are going to be completing or interested in our PGY1 pharmacy residency, the next set of slides tells you a little bit about the requirements for that program. If you are in fact interviewing for one of our PGY2 programs, you can get more specific information from the program director for that program. All of our PGY1 residents will complete direct patient care rotations in medicine, critical care, ambulatory care, infectious diseases or antimicrobial stewardship, as well as clinical precepting. Each of our residents will precept or have primary responsibility for a pharmacy student in their first rotation, while the resident is in one of their last rotations. Our pharmacy residents also participate in our nutritional support service on the weekends and do a 2-week concentrated nutrition support rotation at the beginning of the year. As I indicated earlier, we have a robust pharmacokinetic service, consult service that handles a large number of patients on vancomycin, and pharmacokinetics is something that is woven throughout the resident's experience, both during your individual rotations as well as your weekend staffing requirements. And this does leave some room for some electives, 2 or 3, and we'll talk about those opportunities in the next slide. Our residents also have opportunities in education and communication. Our residents will present a pharmacotherapy update and lecture in our continuing educational series, our Pulse series, as well as present a clinical pearl at one of our pharmacy staff meetings. There are opportunities to present case conference and journal conferences, to develop your literature analysis skills, as well as your case evaluation skills. Each of our residents does a quality improvement project and also is responsible for a medication use evaluation that is then presented at one of the stakeholder committees. As I indicated before, the Master of Teaching program is open to all of our residents, but our residents also will do a significant amount of teaching at the bedside and of pharmacy students while the students are on their rotations. In terms of systems and operations, all of our residents do have a staffing component. Our PGY1 residents will work in the main pharmacy every other weekend and about one night every 2 weeks. That staffing component is composed of some clinical functions, such as our thymoglobulin dosing program for abdominal transplant patients, as well as some pharmacokinetic monitoring. But there is also order optimization and checking that is part of our staffing model. Our PGY2 residents staff slightly less than our PGY1 residents. Each of the PGY1 residents will participate in a practice management rotation, as well as a multidisciplinary committee. The purpose of that multidisciplinary committee is for you to be an active participant in the committee and produce things that are useful to the committee and offer input that's useful to the committee. It is not an opportunity for show and tell for the committee. We want you to be an active part of that multidisciplinary process. And as indicated earlier, all of our residents will complete a research project during their residency year. That may be QI in nature, or it may be IRB approved research in nature. I mentioned electives. There are certainly opportunities for electives. Some of our more common electives are in the area of solid organ transplant and emergency medicine, or even oncology. The oncology elective is offered oftentimes over at the Shadyside campus. Many of our residents who are interested in critical care will complete a secondary rotation in critical care. They will not be in the same ICU that they were in for their required ICU experience. And there are a variety of cardiology opportunities, both in the CCU and CTICU, as well as in our step-down areas, or what is known as the pavilion and outpatient care. So this does not list all the electives that we possibly have. If you have an idea for an elective and we have a preceptor, it's very likely we would be able to offer that elective for you. This year, 2 of our residents are doing some of their ambulatory care elective experiences with the underserved population in clinics that are facilitated by Pitt faculty. Other residents are spending time over at Western Psychiatric Institute or over at Western Psychiatric Hospital doing psychiatric rotations. So the sky is almost the limit. If we have clinicians, we can build a rotation. Our clinical pharmacy programs, which I alluded to, include both pharmacokinetic monitoring and other therapeutic drug monitoring. We do have a significant anticoagulation management program on our outpatient side, and I have alluded to our strong antimicrobial stewardship program. Our pharmacists are participants in our medical emergency response teams and are really the drivers of our medication patient safety component. Our residents will present at PNT, either system or local in many regards, and they lead protocol development and drug utilization or drug optimization development. Nationally, our pharmacists have served at many levels to move pharmacy education or to serve as advocates for pharmacists. And this too can be many of these are our graduates. Our graduates do become board certified, either in pharmacotherapy or another one of the specialties. Our graduates lead pharmacy education. Our graduates lead residency training, and they're leading pharmacy advocacy. They lead patient care, they lead healthcare. And as a graduate of our program, you would be well suited to continue on any one of these paths. We hope that you enjoyed what you learned today about our programs at UPMC Presbyterian and the collaboration with the School of Pharmacy. There is a separate video about our hospital pharmacy service that you should watch before you come on site for your interview. Well, goodbye.